So, hello everybody. My name is Mark Wolf. I'm the Morton Amsterdam Dean of the School of Dental Medicine at University of Pennsylvania. And I'm so thrilled to have you here today at what is our inaugural pediatric oral health community session. And we're going to promise to have more of these to answer questions, to speak with you, to give you more information. Penn Dental Medicine is a historic university that has been here since the late 1870s, and we are an international leader in research, development of new technologies, and new patient care techniques. And we want to speak to our community around us and offer the expertise to you in every fashion, and that's so important. We have a world-class faculty who every day helps assist the patients receive the very best dental care available. So I don't want to take any more of the time introducing, but I want to let you know that we are here in multiple areas throughout West and South Philadelphia, as well as at 40th Street, our parent home here at Penn Dental Medicine, to help answer your questions, to help come into your community and offer assistance in any fashion that we can. So without any further ado, I'd like to introduce Dr. Joan Glutch, our Director of Community Oral Health at Penn Dental Medicine. Joan?
Thanks so much, Mark. And, we've all been so challenged by the pandemic because community outreach, community education has been such an important part of Penn Dental Medicine, yet we've not been able to get to the health fairs, to the schools, to many of the community groups we do. So we've starting this, the first of several series where we'll open up questions for the community members, particularly to ask our experts. So we've assembled a wonderful panel of experts here. Thank you to those who sent your questions ahead of time. And what we're doing now as we begin, we'd like you to complete a poll so we know our audience very well. Please let us know the ages of your children and particular topics you're interested in. So you can see we'll keep the poll open because our faculty presenters will be able to see this and we can concentrate our questions there. So as we're completing the poll, I want each of the panelists to introduce themselves. And I'd like to start with Dr. Betty Velasco, who is the Division Chief for Pediatric Dentistry. Betty?
Okay.
I'm sorry, Betty Hashingalis. Oh, I'm sorry, Dr. Betty Hashingalis, who is the Division Chief. Dr. Betty.
That's okay. Thank you, Joan. My name is Betty Hanjishengalis, and I am the Chief of the Pediatric Dentistry Division at Penn Dental Medicine and the Program Director for the Pediatric Dentistry Residency Program. I'm thrilled to be part of this panel today and help answer some of the questions that you may have, I know that you have, on the oral health of your children.
All right. Now, next is Dr. Maria Velasco. Many of you know her as Dr. Maria. Please introduce yourself.
Hi, how are you? My name is Maria Velasco, and I am the director of the predoctoral pediatric program at the dental school. I also treat patients in the Penn faculty practice. So if there are any patients, perhaps that go to the Penn faculty practice, we're also there to serve you. And we're really excited to be able to answer many questions that you guys may have.
Thank you. Thank you. Next is our public health dental hygiene practitioner, Deanne Wallard, who works with us in pediatric dentistry. Deanne?
Hello, it's nice to meet you all. Thank you for being here. My name is Deanne Wallard. I'm a public health dental hygiene practitioner, and I work alongside with Dr. Velasco and Dr. Betty and work with the predoctoral students working with ages 0 to 5 in our predoctoral program. And this is Al. He came along. He loves to come and visit all the families and kids.
Oh, we just love Al. Thank you so much for bringing him. Now, we're so fortunate at Penn's Dental School to have a registered dietitian work with us. And certainly Mr. Matthew Whipple works a lot in the pediatric clinic. Matty, can you introduce yourself?
Sure. Hi, my name is Matthew Whipple, and I'm a RD and nutritionist. And we've always had a preventive care and treatment aspect to our patient care practices. And along with, oral hygiene instruction and health promotion, nutrition counseling has always been a component of that. So fortunately, they're able to bring in a dietitian as well to meet with patients and to kind of extend those education opportunities. And the best part of the program is that it's free of charge to all of our patients as well. So.
Thank you, Matthew. I know nutrition is such a key component of oral health. We're so pleased to include that. Now, our moderator today will be Dr. Catherine Lee. Dr. Lee, can you introduce yourself?
Hi there, I'm Catherine. I was a previous resident at the pediatric dentistry program at Penn. More recently have joined on as faculty, and as Dr. Gletch indicated, I will be serving as the moderator. We are trying to keep this session as interactive as we can. That's why we have a poll. How we're going to structure this today is we've actually taken all of the questions that everyone has already submitted while they registered, and we've kind of grouped them into categories. And so what we'll be doing is, now that we know kind of what age group we'll be focusing on predominantly, we'll kind of go around the experts. And they've prepared a little short blurb, hopefully answering a majority of those questions. But if you have any more questions, I welcome you to send a message in the chat function of this. If you want to hear a little bit more about something, please let us know. We might have some other questions that might spark some other great discussions, so we'd love to hear from you. And if Dr. Gletch, if you don't have anything else to add, I think I'll segue. It looks like we have quite a few parents whose children are in the birth to 5 years old category. So maybe we'll actually start with Dr. Velasco, and she'll tell us a little bit more about hygiene for babies and flossing. And like I said, if you have any questions, please submit them.
Thanks so much, Catherine. Hi, everyone. So we did see, I think, a good amount of people attending this session have children in the ranges 0 to 5. And in the questions that were received prior to when you register for the event, many patients have questions about how they can help their child have a better experience during their first visit or during their dental visits, because sometimes they do feel they get a little nervous about going to their dental appointments. And I wanted to talk first about that because that seems to be a recurrent question. One of the recommendations that I always have for parents is to use some of the sources that you have from different cartoons. Something like Daniel the Tiger goes to the dentist, the Bearskin Bears go to the dentist, Peppa Pig goes to the dentist. So actually being able to use some of those resources like the book or videos to get them a little more acclimated with a dental visit. That is one of the best sources, and it can really help with the patient getting more comfortable with the environment in the dental office. The other questions we had from you all at that age is, when should your child see the dentist first? And the American Academy of Pediatric Dentistry recommends bringing your child for the first visit by the age of 1. So definitely keep that in mind, as sometimes your child may be a little older, so just feel free to schedule your appointment if they're past the age of 1. And then in terms of oral health, oral care for your child, when do you start brushing their teeth first, and when do you start flossing? So as soon as you see the first tooth, you should start brushing their teeth. And the amount of toothpaste is really what's going to have the most impact. We usually recommend a smear amount of fluoride toothpaste under the age of 2, and a pea-sized amount of fluoride toothpaste over the age of 2, or by the time they have all their baby teeth. Flossing. Flossing is another one of the big questions we have. When should I start flossing? Is this something that we should just do to build a habit? And the best answer really is once you see contacts. And what contacts are when teeth come together. So if your child happens to be one of those kids that has really tight teeth all around, then you can start flossing right away. Most children have spacing at the early ages. So the recommendation is typically once the teeth in the back start getting a little tighter, then you can start flossing. Otherwise, we recommend doing it once or twice a week to build a habit, so that by the time you actually have to start doing it weekly, you already have something to work with.
All right, thank you so much, Dr. Velasco. We had a question about what kind of floss for a 3 to 5-year-old, and actually we have a great visual for you. So I'll let Deanne actually show you about the kind of flossing that we would recommend.
Thank you. We have little floss picks, and they have fun ones for children. The biggest difference is they're a little smaller, and they don't have the pointy end for kids to kind of go around and poke one another. So, and when you floss, you can just take it in between the teeth, and you can just clean one side of the tooth and then the other come out over the gum tissue, and you'll be able to do that. But you can use any of these. They have different fish ones. We have little crab and lobster. We have a little starfish, and our regular little goldfish here is how to floss. So it's always a good idea to get into the practice of doing that.
All right, thank you so much, Deanne. If you've noticed in our chat box, we've included some of those resources that Dr. Velasco was talking about, the Berenstain Bears, Peppa Pig, and Daniel the Tiger. So we have those links posted. But moving on from our hygiene for babies and flossing, we'll talk about some of our habits and some teething concerns that I think some parents had brought as a concern. So Dr. Batty, if you would mind sharing some information about that.
Yes. Thank you, Country. We had a question regarding the timing of the tooth eruption of the baby teeth. So baby teeth usually starts appearing around 6 months of age. Sometimes the baby teeth come earlier than that, sometimes later than that, without this being abnormal. But I would say that if a baby has not any teeth by 12 or 15 months of age, it is advisable at that point to visit a pediatric dentist for an evaluation. Also, it is important for the parents to ask their parents when they had their own teeth, because we do see parents that they had their baby teeth late to have children that they had the baby teeth later. So again, usually around the 6 months of age, the baby teeth starts coming in the mouth, and by 3 years of age, all of the baby teeth, the 20 baby teeth, are fully erupted in the mouth. As far as symptoms associated with teething, usually the children they have fussiness, they have trouble sleeping, they have a lot of saliva drooling. They may have a loss of appetite. You see finger sucking. And as far as what to do at this point, usually we would recommend a teether, and I will show you an example what teethers we recommend. Let me see if you can see that. Let me see. So, let me get this. So you can see on this screen a teether that we yes?
Hold on 1 second. I'm not sure if we quite see your screen.
You don't see my screen? Can you see my screen?
No, it doesn't look like we can.
Can you go back to the Zoom window where you can see all of us, and then make sure along the bottom you find the green share screen, and select the space that you'd like to share?
Yes. Let me see.
Oh, there we go.
Okay. Okay. Yeah. Now you can see the screen. Yeah.
Yes, we can.
So This is the recommended teething device that we would like to use. It's a solid, it's made of firm rubber, and it's one piece. And this is much better than something like this, that it's beaded, because as you understand, the little beads can be a choking hazard. Also, we advised against using the teething jewelry. And you can see there are several of those in the market, like this ankle bracelet here or this necklace over here. And besides being, a choking, strangling hazard, especially the necklace, these beads sometimes are made by some substances that can release succinic acid in the child's mouth, which can be actually harmful. So the best teether is this rubber, this one-piece rubber. What else the parents can use? They can use a wet gauze to just rub the gums, or a clean finger can do the same type of, has the same type of soothing effect. If this is not enough, as far as pain medications, we would recommend Tylenol, and not anything that contains, not any gels that contains benzocaine or lidocaine, or this homeopathic, I think I have another, homeopathic tablets you can see over here, because some of them again contain some substances that they have been shown to cause harm to the babies. And now, when there are also some beliefs that teething can cause diarrhea, or can cause high fever or rashes. Actually, these findings are not very well documented, or we don't believe that they are closely associated with teething. So if a child has a fever, I would say above 100 or 101, and if the parents believe that it has to do with the teething, I think it's better if we exclude any other problem, and it's better if the parents visit the pediatrician to do that. Now, the other question was about habits and what the habits early in life can do. When we talk about habits, we talk about basically the use of the pacifiers and the fingers. Actually, it is interesting that some of the babies who start sucking their fingers or the thumb, we know that they start this even before birth. So it's a strong habit. But the reality is that most of the children, they will stop these habits by 2 to 4 years of age. Now, if the habit does not stop and continues, then it can affect the bite. So you can see here on my screen on the top how a good bite looks in a young child. And you can see here in this bottom image how the bite is affected by a prolonged utilization of a pacifier or a thumb or finger. I mean, both of them pretty much cause the same effect. So it is early on, what we try to do is we try to discourage, after especially the age of 2 or 3, we'd like to discourage these type of habits. And if we see that it persists even longer than that, then we may consider an appliance. Usually this is for a little bit older kids, and there are a lot of different appliances that they can serve as a reminder for this type of habits. Also, it seems that we have some data now to actually advise on the use of orthodontic pacifiers. It seems that these orthodontic pacifiers, that they have a thinner neck, it seems that they cause less of an effect. Again, when it comes to pacifiers, we try to discontinue their use as soon as possible. Usually, for the pacifiers as well as the thumb sucking, the American Academy of Pediatric Dentistry suggests that to stop these habits by 36 months of age, because again, the longer they persist, the more of an effect they may have. And if it continues for a longer time, then this effect is not going to be self-corrected even when we stop this type of habits.
All right, thank you so much, Dr. Betty, for all of that information. I think you also covered some of the questions in the chat box about the pacifiers and the orthodontic pacifier. We did have some follow-up questions for Dr. Velasco, just about how often we should be brushing an infant's teeth, and what happens if an infant wants to brush their teeth on their own.
I did see some of this questions. So one of the questions says, my baby is 18 months old and she wants to brush her teeth by herself. And I'm actually glad that you brought that up, because at this age and between that age and 5 years old, they're becoming so much more independent and they want to do everything by themselves. But unfortunately, at this time, even though you can let them brush first, you do have to go after them and brush for them. And so that you can give them that sense of independence and make sure that they understand that, yes, they can do it on their own, but at the same time, they don't have the dexterity to brush their teeth, to move their hand and brush their teeth correctly until the ages of 7 and 8. So what we recommend is definitely to let them do it, and then you can go back and make sure that they get all their teeth really well brushed. The other question somebody had was, how often should you brush an infant's teeth? So we recommend brushing twice a day. So if you so definitely in the morning and then perhaps before they go to sleep. And the other question was about swallowing the right size amount of fluoride toothpaste as the 3-year-old is not spitting yet. Typically between 3 and 4, kids are starting to learn to spit and they try really hard, but they swallow a good amount. And you do need a little bit of fluoride for the teeth that are starting to form and growing under your jaws. That's why we actually recommend systemic fluoride many times. So if they swallow a tiny bit every time you brush your teeth, it's not that big of a deal. And this is why we recommend a smear amount or a pea size as they get older, because we know that you are going to be concerned that they're swallowing most of it. However, it's such a small amount that it's really going to benefit the teeth that are growing underneath the jaws. And I think, Catherine, I might have covered those.
Yes, you did. Okay. All right. So then I think that covers most of our questions. We'll move on to a slightly older age group and then also talk about nutrition right after that as well. So if you have any questions about nutrition as well, please let us know. But we'll move on to Deanna is actually going to tell us more about hygiene for a slightly older age group for the toddlers and talking about a first dental visit as well.
Can everyone hear me? All right. So when we come to the first dental visit, we try to make it a really fun thing. So like Dr. Velasco mentioned about the Bernstein Bears or Peppa Pig going to the dentist, playing dentist a little bit ahead of time really makes for a really nicer experience for them. It's always good to tell them that we're going to count their teeth. We have a little mirror that we use and we have them open wide and we count their teeth. We are going to brush their teeth for them and make them sparkle and shine. We are going to floss their teeth for them so that you know how to floss when it's time to start flossing. Like I said, Dr. Velasco mentioned, it's a really good idea to start practicing flossing a couple times a week so that when you need it more often, you've got it. It's not a foreign thing for them. And then we may take some pictures of their teeth when they're in the dental chair, not always for their first visit, but it depends on their age. And then we're going to place some vitamins called fluoride on their teeth afterwards is what we recommend. And that's going to help the teeth become stronger, stay strong. So that's kind of the first dental visit. It's okay if they cry. We're used to them crying. It's very normal for them to cry. We're having them do something that they don't necessarily want to do at the first time. So we recommend brushing. I was kind of demoing here with Al about brushing along the gum tissue, and that goes for you adults as well, not just the kids, but angle it 45 degrees up on the brush with a little circular motion. When we brush our kids' teeth, we tend to tell them to open, and they open really wide, and that cheek gets a little tight in there. So after you get the toothbrush in along the side, you can have them close down a little bit, and you'll be able to reach the very, very last teeth. Now, Al has great big teeth, not like our little kids' teeth. When we do the flossing, like I showed before, once the teeth are touching, that's when we recommend. And I would say that we start seeing the cavities form in between the last two teeth most frequently. So we recommend that once teeth are touching, that it's really imperative that you floss every day. And again, kids like to do it themselves, but they can floss a little tough, so it's good for you to do it until even a little beyond toothbrushing. I find that they need a little help with that. It isn't how hard you brush, it's how long you brush. So as long as they will allow you to, and if they really resist getting their teeth brushed, you can choose a time during bath time, sometime that's fun, make it a fun game for them to do. There's the great videos on TV or on the phones that they can watch that make us sing a song along with it. So there's a lot of ways to make it fun for them. And the biggest thing is if they cry, not to be concerned about it when they come to the dentist. We're just doing fun things with them. And then we always give them a prize when they're done and a new toothbrush to take home.
All right, thank you. I was going to add that there is a really great question that was submitted ahead of time. Should a child rinse their mouth with water after they brush, or should they just spit it out and leave the residual in their mouth? Because I see some parents who are concerned about that residual fluoride effect. Would you comment on that, Liz?
We recommend that you just spit it out and be done. That little bit of fluoride that left in, the longer it stays on the teeth, the more beneficial it'll be in being absorbed by the tooth structure and making it a little bit stronger of a tooth for them. It helps fight off the worries about juice is one of the biggest culprits of causing cavities in our young age group. So that kind of leads us into nutrition. Matthew will discuss that a little bit, but that little bit of fluoride will help fight off the acid that is produced by the juice on the teeth.
Sorry, that was a great movement over to Matthew if he wants to talk to us about nutrition, especially in this age group. And then it looks like we have quite a few questions about fluoride, so we'll come back to that after.
Great, yeah. So I think most importantly, I think the things that parents are focused on in this age group are two main things. First, how to sort of prevent or lower their risk for developing cavities. And then the other is, optimal foods and nutrition for proper growth and development as well. So I'll talk about the growth and development aspect first, right? So basically, a lot of parents, especially when we get to that toddler age group, they talk about their kids being like picky eaters, being very selective with eating, eliminating whole categories of foods and things like that. Some things to keep in mind. So, a lot of parents say, well, my kid only likes to snack very frequently. He doesn't like to sit when we sit together and have, a meal together. He doesn't really want to eat those foods. Well, thinking about, if the child is frequently snacking, he probably has a less appetite to want to sit down and actually eat the foods that are nutritious that are on the plate. So trying to make that switch to making sure that he's having really nutrient-rich foods on the plate rather than energy-rich. So when we say nutrient versus energy-rich foods are ones that are high in calories, like snack foods, like cookies, like cakes, like chocolate milks and things. Nutrient-rich foods are foods that are high in nutrients, like fruits, vegetables, whole grains, good sources of lean proteins, things like that, right? So by looking for simple ways to sort of incorporate more of those nutrient-rich foods that'll help to satiate the appetites, and the kids will be less prone to more frequent snacking. Some things to try to get kids maybe who are a little bit more resistant to eating fruits and vegetables is, depending on their age group, having them become a little more, involved in the process. And that can begin as early as, when you're at the grocery store, having the child select an item they've never tried before, a produce item that's familiar to them, have them select it, then bring it home, have them sort of help with, preparation. So they can help wash the vegetables. They can help maybe slice things depending on how old they are. They can help add ingredients and create a dish together. And then you guys can sit down and have that food together. And the kid is a little bit more likely to want to at least embrace, maybe not try it first, but at least be a little more comfortable with embracing those types of foods as well. I know that some of the questions that have been submitted before, some parents were asking about like nutrient deficiencies and things like that. Some of the most important nutrients at this particular age group would be things like calcium, right? So we get those from a lot of yogurts, milks, cheese products. And that's also goes for the fortified milks as well, like almond milk, rice milk as well. Also those leafy green vegetables, so like collards, spinach, kale. Those are things you can easily put in like smoothies for children. You can kind of hide them. You can incorporate those into like soups, like spaghetti sauces, things like that. So there's ways you can kind of maybe incorporate some of those foods to make sure those kids are getting those good sources of calcium. Iron also is really important as well. So that comes from like whole grain sources. So looking for, if your kid is someone who likes sandwiches or crackers, looking for those whole grain alternatives, whole grain, whole wheats. A lot of kids eat ready to eat cereals as well. So just looking for those whole grain components in those, rather than those ones that are more like the cartoony versions, things like that. A lot of leafy greens, asparagus, it's good sources of iron, lentils, beans as well. And remember, like a lot of absorption of iron comes from when you pair them with foods that are higher in vitamin C rich foods, which a lot of people think, okay, orange juice. Well, oranges are not the only fruits and vegetables that have high sources of vitamin C. That's broccoli, Brussels sprouts, cauliflower, cabbage, kiwi fruit, potatoes, strawberries, sweet potatoes, tomatoes, you name it. There's a whole slew of different fruits and vegetables out there that are also great sources of vitamin C. To address the other question about, sort of reducing risk of cavity development at this age group, there's sort of two main sources we see: snacking and then what the kids are drinking as well. So looking for those, nutrient-rich snack options, something as simple as having pre-chopped fruits and vegetables in little snack bags or containers in the fridge so the kids can access that easily, or using containers that are clear, that are not, so that the kids themselves can see those foods and easily identify them. Having those less nutritious snacks kind of hidden in a place where it's not as easily accessible to the kids as well. And then, obviously we talked about like the juices, the chocolate milks, things like that. So making sure that, kids under the age of 2 should not be having any type of like juice or like a sweetened type of a beverage at all. Above the age of 2, you can sort of begin to incorporate about a 4-ounce portion of juice. But if your kids are going to have those things, make sure they're drinking that when they're eating other types of foods as well. So like when they're having their breakfast, they can have a little 4-ounce glass of orange juice. The chewing process is going to help increase the production of the saliva, which will help reduce a lot of the residues that remain from those foods. I wanted to take a quick second a lot of parents think that they're, it's very overwhelming. Parents are really, we're all really busy people. You have several kids at home working, running around. You feel kind of helpless and at the whim of a lot of these, big food companies and just like the convenience of life. But I just wanted to remind parents that they do have the tools and resources, provided to them to make healthy decisions. They just have to know how to access that information. So take something as simple as like a pineapple juice, right? So this is a 6-ounce pineapple juice. So it looks like it's in a small little container, and it seems like something that would be great for a small person, right? So two key things to remember is there is some information provided here that's going to help you to make those healthy decisions. The first is when we look at that nutrition facts label. Okay, so that provides us with all the sort of important nutrients that we look at, including the amount of calories and the sugar as well, right? So we see right here where it says that 22 grams of sugar. The other thing we look at is the ingredient list, and it's probably hard for you to see, but if you actually do a Google search for sources of sugar, you'll come up with like a food map that has probably 50, 60, scientific terms for sugar. So it's not always easy to recognize it as like, sugar, honey, molasses. A lot of them have these really complicated scientific names. So that makes it really, really challenging. Something simple that you can do at home, and you can do this with your child as well. You can do a little bit of an experiment, is you can look for that sugar that's on that label, and then you can actually take something as simple as a teaspoon, and you can measure out the amount of sugar that's in that product, and it gives you more of a visual representation, because I think we all work and live in visual representations rather than something as scientific as what 22 grams equates to. So if you use this formula here, you take the number of grams, divide that by 4, and that gives you the number of teaspoons, okay, of sugar. So something really simple like that. Number of grams of sugar divided by 4 numbers of teaspoons. And for this pineapple juice, you'll see here, there's 22 grams of sugar. We divide that by 4, and that gives you 5.5 teaspoons of sugar. So I take my teaspoon here, take my glass, and I measure out 5 teaspoons. And you can do this with your child as well. I know everyone's home learning right now, so this is a great way to do a scientific experiment. So that's 3, 4, 5, and here's our half. So then you have a visual representation of the amount of sugar that's in this one little glass of pineapple juice. And I can show you that right here. If we pour this juice into the glass, and you'll see how much of this juice is actually the sugar and the rest is water, right? So you can see right there, it's a very big amount of sugar just in this one little glass. So to get that amount of sugar by eating pineapple, you'd have to eat this big old giant container of pineapple here, right? Which is probably a lot for a small child to eat. So something sensible, as it could be a good snack, would be about 100 grams, which is about a half a cup serving of pineapple, which only gives you 10 grams of sugar and a lot of other great nutrients as well, including fiber, which is most important at that age group as well. So I know I threw a lot of information at you. I just want to remind everyone that the dietitian services at PDM are free of charge. So I encourage you all to reach out if you ever have any questions or concerns, or you want more, great resources or ideas or recipes, tips, things like that. So thank you.
Thank you, Manny. That was an amazing presentation and visual. I didn't even know your table in front of you was that big to hold all of those items. You just kept pulling up, and then even whole pineapple. That was pretty great. We actually had a really great question that was kind of a follow-up about your fruit smoothies at home. But there's a question about an occasional fruit smoothie, once per week, a teacup portion size for a 3-year-old with no added sugar. We were wondering if that was good, or what you thought about that.
Yeah, so I think they hit on all the key points there. The teacup portion size, right, which is important. So portion size is important, and with no added sugar. And like I said, you can easily sneak some of those other, like leafy green vegetables, like you can get frozen spinach and things like that, and you can add those into the smoothies as well. So you can kind of increase their nutrient-rich components, and it doesn't really affect the flavor. It's an easy way to get kids to eat their fruits and vegetables. So I think that's a great idea.
Perfect, thank you. So going back, we had a few questions about the safety of things. So we had the safety of x-rays. A couple of parents were worried about how safe x-rays were. And then there was also the safety of fluoride, when we should be giving fluoride toothpaste to a child. So I don't know if Deanne or Dr. Maria would like to comment on that and the safety of things that we have in the dental office. That would be really great.
So I can start with the safety of radiographs. So We recommend taking radiographs on young children once the contacts, and it comes back to like the beginning of our conversation, in the back of the teeth, when there's no space in between your teeth, you should start flossing, because what you end up seeing otherwise is cavities starting to form when you take x-rays, and this is actually one of the reasons why we typically recommend doing them. And we don't take x-rays as often, but we do it based on caries risk. And what does that mean? That means that if your child is brushing twice a day and eating overall a pretty well-rounded diet, meaning that they're getting a good amount of protein, some sugars or smoothies, but no added sugar, then and their hygiene is okay, then the risk is lower. So the recommendation for the frequency of the x-rays are going to be more between 12 to 18 months as opposed to like 6 to 12 months. Now, if your child has had multiple cavities in the past 6 months or a year, there is a likelihood that we'll just take 2 x-rays of the back teeth a little bit more often, so that we don't miss any cavities. And we can catch them actually when they're very small to treat, rather than by the time they're large, and then we need to do more advanced and more and treatment that requires much more, that can be more invasive, and that requires perhaps like a crown or an extraction. So it's really to avoid trying to do anything too invasive in the long run. And the safety of fluoride. So the question in particular was using fluoride in young children as they swallow them. So I had kind of mentioned, I had talked a little bit about that it's okay to swallow some of the toothpaste. We do recommend young children to have some fluoride, just a bit of it that's usually in the tap water. And the reason why, again, is because there are teeth forming underneath the jaws believe it or not, at birth. So the 6-year molars, those teeth that you're not going to see until the children are 6 years, these start to calcify and form and all at birth. So don't be afraid to use a little bit of fluoride when brushing your child's teeth, because it does 2 things. It's going to help them with the calcium, with the teeth are present already in the mouth. It's going to strengthen that enamel, and it's also going to help if they do swallow some of it. It's going to help the teeth that are forming at this time.
All right, and I think there was also a question about what kind of water is recommended. And so I think you touched on that about tap water.
Yeah, and the tap water. So, it's not all size fits all. Some places have fluoride in the water. A lot of places outside of cities don't. So what I typically tell the parents is, if you want to be very specific on whether and know whether you have well water, if you have well water at home, or what type of water you have at home, I will just go online. We have a couple of websites that we can show to you, or I even tell them just call your town and find out if there is fluoride in your water, because you know what, all the filters, Brita filters, are not going to eliminate fluoride from the water. The reverse osmosis, if you happen to have one of those at home, then you know what, that potentially is going to eliminate fluoride from your water. But I have found from my experience that very few people have reverse osmosis filters in their home. So if you do have one of those, then you may have to look for alternatives on where you're going to get your fluoride sources. And I will have that discussion with your pediatric dentist at that point, because they may recommend adding drops, as well as if you have well water only in your house. I hope that answers that question.
I hope that did too. We are trying to create an FAQ and kind of gathering all of this information together. So if there are any other follow-up questions, we'll also post some information about getting in contact with us, that we can answer those questions as well. I think the last age group that we'd like to touch on is the older age group. And there was a question previously about braces. And we had a parent who had a child who was still thumb sucking until I think 11, if I could be wrong about that. And so if we could talk about braces and a little bit about what to expect with that, Dr. Blasco.
Sure. And I actually wanted to share some things because we had a lot of questions about braces, and I see that a good number of you guys. Can you see my screen here?
Yes, we can.
Yeah.
Yes.
So this really comes down, and I'm going to try to tie it up here now. Once we recommend having your child see a dentist by the age of 1, and after that, routinely seeing them for 6-month checkups. So once the dentist starts seeing them, they'll catch on a lot of little things, like this tooth is a little, it's misplaced, or this one is a little more crooked, or your child may be a little crowded. So those are the kind of things that they're going to be able to see when you come for recalls. It's not just for the cleaning, and obviously, and the cleaning and the varnish are very important, but the clinical exam and what they find during these visits is really what you want to make sure you do. So we highly recommend visiting your dentist every 6 months, because you'll find a lot of new recommendations that you had no idea that you could be doing for your child. But the American Academy of Pediatric Dentists and Orthodontists typically recommend, when they see anterior cross bites, and I have an example. Let me see. The very first picture shows a partial cross bite. So when the teeth are actually, instead of biting the upper teeth, biting with the lower teeth, in front of the lower teeth, the other way around, then they typically recommend seeing the dentist the orthodontist soon. And to try to correct that crossbite right away. That is, many orthodontists are going to try to work with your child, but if the behavior is not quite there, it may be very difficult to start orthodontic treatment and be consistent with it for a long period of time. If you have older children, you may be familiar with orthodontics already, and it takes typically definitely over a year, sometimes 2 or 3 years of periodic visits to the orthodontist. So it does require some cooperation from the part of the child also. So because of this, a lot of that orthodontic, the right time, when the checkups are recommended, it's usually by the age of 7. And that's when we really find that children are actually much more prone to being okay to having an expander in their mouth or having some type of orthodontic treatment. In terms of orthodontic treatment, they will see an orthodontist soon if they have this kind of problems. So if they're very crowded, or if they have cross bites, or if they have a habit like Dr. Betty mentioned. So if you see any of that, there's a high likelihood that you're going to see the orthodontist between the ages of 7 or 8 to try to correct some of that. And that is known as interceptive orthodontics. Now, if your child doesn't have any of these issues, and they still need braces, the dentist is likely going to wait until all the baby teeth fall out. On average, that's around the age of 12. A lot of children can lose all of their baby teeth by the age of 10. Some of them lose them by 14, 15. So you may have to wait a little longer, but most on average will lose them by 12. In terms of hygiene for these children, again, it comes down to how good they brush their teeth. And the dentist is actually going to be able to look at this during the exams. If the dentist thinks that they're not brushing so well and they're going to need a little more help because their gums are puffy or and bleeding, or if we see some signs of cavities, the dentist may actually want to start seeing them for cleanings more often than every 6 months. So they may put you on the hygiene schedule every 3 to 4 months so that they can actually help your child keep in good oral hygiene during this time. It's very difficult to brush your teeth with braces. And that's one of the things that I always emphasize to parents. I'm like, well, he will need braces, but we may actually need to make sure that they start brushing well, because their teeth may be straight, but they may have a lot of cavities by the end of the orthodontic treatment. So it's really important to keep up with those visits as well. In terms of hygiene and brushing at home, we recommend brushing twice a day. Flossing tends to be a little more difficult, but there are, sorry, I'm going to stop sharing, but there are some special type of flossers are actually designed to use with orthodontics. So I'm happy, to go over this with anybody that has a question specifically about that type of floss. They're called super floss. They also have those little picks like Deanne was showing, but those that are specific for they are designed specifically to fit around braces, and they're fantastic. There are some brands that have them, but again, I'm happy to go over that. And Megan just posted a link for them as well.
All right. Thank you so much, Dr. Velasco, for all of that. We're running out of time. It looks like this session really went by quickly. So I'll pass it over to Dr. Gletch, who will have a little bit of a summary of everything today just to finish us off.
Oh, thanks so much, Dr. Catherine. And wow, didn't the presenters do a great job? Because what we really talked about are some really universal things that we go throughout childhood, but specific at different age. Dental visits are so important at every age, beginning at age 1 and really every 6 months. And we think of it as a time to not only clean your teeth and check for cavities, but answer your questions about these key areas as well. Give you more information. Check the bite to see about the orthodontics. So I think those are some really critical components. Boy, so glad we invited Matthew Whipple. You see how important nutrition is to a developing child. And you see how at Penn Dental Medicine, we believe nutrition is such an important component that we have a registered dietitian available to you. Really think about those nutrient dense. Matthew, I really like that, nutrient dense rather than energy dense. We're going to be looking at additional calcium foods, additional foods for iron, but especially we're going to reduce the snacking, because more of those snack foods are going to increase decay, but also those darn sugar sweetened beverages. I'm talking about the juice boxes for the children. The juice boxes, although it's natural sugar, it's still going to cause decay. Those sports drinks for older children, they not only have increased sugar, but they've got phosphoric acid. The two of them really, phosphoric acid and the sugar increases the risk for dental decay. So at each age, select water and nutrient-dense foods for the children. And of course, then everyday brushing. Always remember the twos, twice a day for 2 minutes. Flossing is necessary, but this is a lot of fun. And you see how much we enjoy educating and providing the information as providing care. Now, I know those of you who have our website information, you can make an appointment through the website. You can phone our call center. We encourage that you visit the dentist and routinely together with your child. You know, we talk about family dental care, family visits, both for you and your child, family brushing activities. It really promotes good oral health for the lifespan. We're just about at our time. Thank you so much for everyone for completing our poll, because that will give us information how to improve our program. And what do you think, all the faculty? This is kind of cool. We should do this again, shouldn't we? And we'd be happy if you could visit us again. Dr. Lee, anything final?
I think that was everything. Thank you so much for our panelists for doing such an amazing job. I hope everyone learned quite a little bit more.
Yes, and we look forward to seeing it. Thank you, everyone, and have a wonderful day.